This COVID-19 awareness program is supported by Telecom PNG, Always There, and Protex, Clean Hands, Good Health.
Good afternoon. You're watching COVID-19 Awareness. The coronavirus crisis had many countries impose restrictive measures to contain the outbreak. This can have a negative impact on people's mental health and well-being. Fear and anxiety over this disease can be overwhelming for both adults and children. We have here now in studio Dr. Uma Ambi, who is a psychiatrist, who will be talking to us about the signs to look out for in your homes if someone is experiencing stress and anxiety during this lockdown. Doctor, thank you so much for making the time.
Thank you, Dini.
Now, look, what are some things you can tell us, what signs we can look out for during this lockdown, especially in homes where people are in lockdown and, you know, it's a stressful time? What signs do we look out for?
Well, Dini, to be very specific to the COVID-19 itself, you can see that osemlo physical distance, because it's a virus. That means this particular sickness is having a toll on the humanity.
Oh, yes.
So by hearing it, and by experiencing and also looking, are we going to get, and what's going to, if this happens in the world, what is going to happen? So Emia and by giving you some kind of fear by come up. So I wanted to stay this last side, like also physical distance and social isolations, and also closure to school, workplace, lockdown, and by you savilo
the
this
normalcy.
So you're stopping the people from what they are doing every day.
Yep.
Wow, lockdown. Then the human mind is now like what to do next. So Osemna, this time is very important. Then any abnormal reaction, abnormal event, there is a normal reactions. So I want to tell the people, don't get frightened at this point, but you will feel you have fear, you will have confused, and you can be anger, and then you can feel sad at this point of the crisis.
What are some ways to deal with these reactions to the stress during this lockdown?
Okay, so I had to say to everyone, it is a normal reaction to an abnormal event. That means your emotions are going to have shock, fear, anger, sadness, and all that. Physically, you will be sleepy or doing other physical issues and thinking there are other memories and abnormal, like using alcohol and things.
Doctor, I think there's a live update coming in right now from the command center, press conference live.
Yes.
That is. So we'll cross over now to see this update.
Pasapa si stop lo na all walk about na all talk number na stop lo emba nogat. So this la talk you go around lo Facebook na all this la kind something gaman. So now me losing one them deputy controller na acting secretary lo give some talk lo COVID-19 lo tete. Thank you.
Thank you, Minister, and thank you, Papua New Guinea. Good afternoon, and thank you for the controller for the opportunity to speak, and thank you, Minister. I'd like to say this afternoon, especially relating to one of the initiatives that we are now initiating, and that's called targeted sampling. Targeted sampling is an important initiative that is part of what we want to do in terms of scale up, doing the testings throughout the country. And so we want to target the key settings, what we call the hotspot, if you like, settings of Port Moresby and Lae, and they are potential hotspots. So we want to see how the transmission of COVID-19 is. And so in these settings, what will happen is that there are pre-triage areas already initiated within the facilities, health facilities, with the primary function of being to analyze the case definitions and link with the contact tracing. And so this will be where our people will go through the rapid response testing, and our teams will then be properly attired with the appropriate personal protection equipment, and all testing will be conducted in these controlled settings. Our aim is to have the capacity to carry out 1,000 tests across Port Moresby and Lae. We are also training our teams and providing the infrastructure to have the ability to test along our border towns of Wewak, Kiunga, Vanimo, and Daru. We are committed to giving our border towns the capacity to conduct 1,000 tests. Now, all of you, or many of you, would have seen what's happening in the Port Moresby area, National Capital District, and one of those settings is called the Rita Flynn Court. There is facilities that have been built and undergoing a huge transformation. Now, this is where we will have what we call the isolation ward. This is where if we do have infections of COVID-19, then this is where a big part of our patients will be. Most of these people who will be in this Rita Flynn Court will be mild to moderate, and so we keep them there until the infection is cleared in Port Moresby. Currently, there are no cases, and this should come online next week. So this is just to let you know about what's happening relating to isolation facilities. But do know that isolation facilities are also being worked on throughout the country. As the Minister alluded to earlier, COVID-19 is not a disease that is airborne. COVID-19 can only be transmitted through droplets through the mouth and nose. That is why our message have all been around keeping safe physical distance, 1.5 meters from each other. We further emphasize the need for improved hygiene, proper cough etiquette, and resisting the urge to shake hands. Thank you. Ladies and gentlemen, thank you, Papua New Guinea.
Thank you, True, Deputy Controller and Acting Secretary of Health. Today, Bami Lucy want to report just 5 key messages. What's in hand, blow you blow at a time. Suppose you got cough, you go inside the elbow, blow you. No can touch him, pest, blow you. Now, one blame. You keep him safe distance, slow, not a blow man. Also, you look at me plan now, yeah. Mission up, lawyer. Controller, son of blow Deputy Controller, son of blow and me practice him. Personal space. Now, number 5, the most important something. Simply stop the house. Suppose you don't walk outside, stop the house to solo. Area blah. Na bayi mi looking most this la COVID-19 banana come up the house. Thank you, True. Suppose you got some question is stop. Controller blah stop. Deputy Controller stop. Na me stop. Thank you, True. Na God bless lo iplo got a line to Papua New Guinea. We come lo mipla lo here lo Port Moresby lo knock 19. Na government lo mipla the Marape Stephen government mipla talk. Thank you, True. Lo mipla harim tok lo mipla abiding more rules. Mipla set him inside lo this la state of emergency. Na bayi mi looking mo some country lo mipla by come up good luck in. Thank you. Na God bless.
The controller said that 160 test kits were distributed to the 60 provinces. When exactly will the 4,000 test kits from Australia be arriving in the country for this mass testing of people around here in Port Moresby and Lae? The Secretary or the Health Minister can?
I can answer that one. The test kits have come in today, and we will get our logistics people to separate them and make sure they go out to the provinces. And as the Deputy Secretary did say, that we will be focusing on the border towns to make sure that we contain COVID-19.
Can the Minister also confirm that there are actually 500 PPEs in country and not 20,000 as specified by the Health Secretary?
Actually, 200 PPEs have been sent to all provinces that we know. Now, the 20,000 that we are referring to have been 20,000 in the Port Moresby General Hospital setting. So that's where the PPEs are. But as we speak, we are working towards ensuring that we get PPEs to be procured and brought in to the country.
What is the exact distribution in terms of what the province has for this 200? Is it 200 each to each province?
That's already gone to each province. We've supplied them to each one of those provinces, the 200.
Secretary, there were 16 persons of interest at Eden Valley. 15 underwent tests and 1 got away. The one that got away, there are reports that he went to his own province in Timbu, and people up there, panicking. Can you give them comfort if you found a person and has they been tested?
Okay, maybe I'll let the controller say something on that. But let me assure the public that this is now day 17 of the contact tracing that we are doing. We've got another 5 more days, 4 more days. Day 21 is when we finish off this contact tracing mechanism. And so, as you know, there's 14 days of the incubation period of the virus. And so I would like to assure the public that by day 14, this whole thing would have been already resolved. But we just continue to monitor until the day 21 when we then close off these cases. But I'll get the controller to say a few words on that particular issue.
Thank you. And again, let me, from the health experts that are, advising us on what's the appropriate response to this, to the national response to combating the spread of COVID-19. Again, in as far as the 14-day window that was developed or understood to be the incubation period and where we're at the most highest risk of the spread of COVID-19, all indications are that we've as we speak, that we've contained it to a level not entirely a watertight sort of situation, but at least to a level where we can confidently progress with our response capabilities. Now, I understand that in Chimbu there may be, and as you said, that there's rightfully said that there may be concerns about their safety and their health. Look, we are aware of this particular person that had of his own wish had gone back up to his province, and we have both our military and police personnel tracking that particular person and ensuring that that we not only bring him to custody but also have the opportunity to test him as well. But at this point, as Dr. Dokolala says, if we're not picking up any traces at this point, then whilst it's far from it's not the best situation to be in because we haven't tested that far, but if there was a potential threat or risk of it being spread, then we'd be seeing signs of it by now. But again, as I said, let me just reassure that the next 7 days is all about targeting sampling or tracing, as Dr. Dokolala has mentioned. So we have not stopped. Just because we haven't picked up one positive case does not mean that we can say that we are 100% COVID-19 free. Our efforts continue well beyond, and we've extended it for another 21 days. Over the next couple of days, we'll be happy to report that there'll be teams, rapid response teams, that are currently being stood up now, that will be sent across to our border towns, because that is where, based on assessment and intelligence reports, is where our greatest risk and threat to the spread of COVID and importing of the COVID-19 virus is through our borders. So over the next couple of days, we'll be deploying teams, rapid response teams, to go and actually do random target sampling from Vanimo all the way down to Daru, but also including East Sepik as well, so parts of East Sepik. As we know, it's been widely publicized that we've had and reported that we've had incursions across and a movement of PNG nationals across the border. The governors for both East and West Sepik have continuously feeding us back information as to the numbers that have been reported to them in terms of Papua New Guinea nationals traveling back and forth. And look, whilst it's irresponsible, and it's our view that it's totally unfair to the rest of the country to have, and it's totally unacceptable for our Papua New Guinea nationals to put everyone else at risk in the pursuit of doing business or whatever you saw. We're closely working with both the governors of East Sepik and West Sepik to ensure that those that have been identified are tested, and some contact tracing is done on those. So vigilance is our greatest ally at this point in time. We cannot afford to be lax. We can't afford to be complacent. We heard from the Prime Minister yesterday saying that any Papua New Guinea national deliberately crossing borders into Indonesia, and if they're picked up by the Indonesian authorities, then it is a matter between that particular Papua New Guinea national and the Indonesian authorities, and they will, and that is something where we will gladly assist in ensuring that we provide the necessary assistance to the Indonesian authorities if we pick up Papua New Guinea nationals that have deliberately disobeyed the border closure restrictions. Thank you.
Yep. We got sent SOE orders,
yes.
Sorry, national emergency orders.
Yes.
That come from you. Can you just clarify for what period are these orders for?
So as it stands, it stands in that NEC endorsed period of the 14 days. Okay, so and then of course subject to. So those emergency orders, just for the clarification of everyone, those emergency orders basically have a sunset clause, and that sunset clause is when the actual SOE either terminates through a decision by Cabinet or Parliament in this case, or if the situation changes, if there's some marks and requires either those orders to be rescinded and new orders put in place. So the short answer to your question, it is for the duration of the state of emergency.
Can you also give an update of the Bommana? We were told that Bommana, the place where the refugees were supposed to be kept, up at Bommana, it's been considered, or it's supposed to be a quarantine place, but we haven't received any updates about that.
We're looking at other options.
Okay, so when we were looking at possible sites where we could have basically for the purposes of quarantine and isolation purposes for COVID-19 suspected cases or confirmed cases, the Bommana Immigration Center was identified earlier on as being one of those probable sites, along with other sites around the country. Through the WHO, you can see from Rita Flynn, we're hoping to set up similar sites around the country using our supporting facilities. That again is subject to further consideration whether or not they'd be appropriate, because with these sites we need to make sure that we have proper ventilation, power supply, water supply, all the things that would require to support basically what a field hospital. Okay.
Commissioner, any update on the Australian couple that crossed over? And I understand you've made contact with them. Also, how about the 4 PhD crew that have been quarantined and their samples sent over to Goroka?
So we'll answer the first. The 2 Australian nationals that are being currently processed by our task force investigation team. With the 4 crew, I'm unaware of the test results of them. But there's still from just being briefed that they're still being those tests will still be completed, still yet to be finalized.
How many tests do we have at PNGIMR at the moment?
I can 85.
That hasn't been processed, hasn't it, without the results?
7.
And who are they? Exactly the samples?
We'll get the information out when it comes up.
Yeah. I mean, we'd like to, again, figures, we can report on figures and the number of tests that we've done, the number of basically the results of those tests, but we can't, just to ensure that there's some proper management protocols around as to where those tests come from. This, as you said, your colleague there asked a question about, should Chimbu province go, fall into chaos because of one suspected, case. So we just need to manage that information, responsibly. So, so we can, again, have the proper, responses if we see that, those tests indicate that there would possibly be outbreak in a particular area. That's something that we just need to manage properly.
Health Minister on Sunday made a statement and said 400,000 kina was supposed to be released to provinces on Monday.
Okay.
And you're reviewing provincial plans. Can you give us an update on that?
Thank you for that question. Yes, we have the 200,000 kina ready to go to the PHAs. That'll come under strict guidelines to the COVID-19 facilities and how to use it. Sorry, what was the other question?
You're reviewing provincial plans.
The provincial plans have come in and we're reviewing them at the moment to make sure that they align with the national, the national plan. So we should have that out within the next couple of days. But thank you truly, blogger to come. 1 plus something, Milak Lusim, one you plan. The toll number is 1-800-200. It's not a joke. It's not a play number. It's a number where serious things happen, and we want serious reporting. We're getting a lot of calls about sending flex back to people, and they come up with really unintelligent words and asking very unintelligent questions. Please utilize the number. It's for the safety of our country, and we have people here working 24 hours manning this call center. Today we had a 1 hour where we had a problem, a glitch with the system, but we got back online. But it's being overpopulated by questions that are nothing to do with COVID-19. And we urge everyone in the public to use the number wisely. Thank you and good night. God bless.
Yeah, look, important information, updates there from the command center. Dr. Ambi is still here with me in studio. Doctor, recapping on our discussion from earlier, we were talking about how the lockdown is causing stress and anxiety. Just share with us some ways of coping with stress and anxiety at this time.
Yeah, thank you, Dini. It's the most important thing all man may masabe or same this la time. One him something you may harim and by creating that is normal reaction to an abnormal event. And you may masabe. So normally feel sad, na stress, na confused, na cross, na scared. Now all this like am normal. So you're not going crazy. Let me assure you, it's normal way. So strict to look low one something. Now you take home message to talking to the people. Most importantly, to stay at home and continue to do what you have to do, like isolation and all these things you have to do. But the most important thing is the healthy lifestyle. You may get plenty kumun about lo step lo house. So kai good, sleep good, exercise good. Exercise doesn't mean you walk out of the room and go party time. You walk in lo sampla way lo making you exercise so that you stay healthy and feel better. And also you will see don't use, like you can use email, phone to be in contact, communication with, it's all about keeping mind is positive and optimistic sort of way.
Basically avoid emotional,
yes. So that's where you go out of place, you see. And then don't use smoking and alcohol and chewing buai as a way of mocking out, because a way of sorting emotional issues. So if you feel overwhelmed, get the help, like health worker, or get some mental health help, because you're not going crazy, but there's a normal way for a few weeks time, and then you get over. So if the symptoms last beyond 4 weeks, weeks or 6 weeks, then you need more help. The other one, get the facts right. Don't get into the rumors. Get the right information from the right place. Like World Health Organization is helping us to disseminate the information in a right way. So get the right people and get good information. And also precautions. That means go back to how the controller was talking about how to make sure you do those things and limit your worry and agitation, kiss him cross about, and listening with all these things, make a positive. That means, motivate yourself, inspire yourself.
Speaking of which, you have a hotline app as well for people who need to have some form of counseling.
Yes.
The number is 7907-4944. That is a number you can call to get some form of counseling as well.
And I think this is the right time for especially friends and family, keep the distance, but create your emotions in a more positive way. Draw on your skills that you might have lost in the past. Create cooking, create gardening, create things you can do, and more importantly, spiritual nourishment. I think it's a time for us to build up our relationship in the isolation, then with the people, trust in the Lord, and the spiritual nourishment, apart from physical, mental, and the spiritual nourishment is the key for our success and go towards positive and optimistic life. Yes.
Very true, Doctor. Look, thank you so much for your time, and we look forward to having you again on this awareness program in the next few days.
Thank you.
We'll go for a break now. Join us after the break as we give an update on the state of emergency in the country.
A global pandemic has been declared by the World Health Organization.
Covid-19 can be characterized as a pandemic.
Our government, agencies of government, SOEs, business communities and the citizens of PNG are expected to mobilize and stand together to fight this common global enemy, COVID-19. We do this in two ways: follow the directions and adhere to messages from the government and authorities. Come forward and assist the authorities. We at Telecom chose both. We join the government to appeal to every citizen to practice good hygiene and to take extra care. And in case of emergencies, please contact our hotline on 1-800-200. Telecom PNG, always there.
Help stop the spread of germs and protect your loved ones with Protex. Here are some simple hand washing tips. Use soap or liquid hand wash. Vigorously scrub hands in circular motion. Scrub in between fingers and nails. Do not forget the back of the palm and around the wrist. Rinse with clean running water. Dry hands with a clean paper towel or cloth. Protex. Clean hands, good health.
Welcome back. We have received updates from the State of Emergency Controller, Commissioner David Manning, on the persons of interest who came in contact with the first imported COVID-19 case.
Prime Minister Taupinis, all the test mit Baronim lo online where all been stopped in contact one time first man and been kisim loem all the tests will come back loem negative. So this case has been come out from Singapore, come to Mosby. Inside this flight been come to Mosby been 83 all man where me looking at all need lo you meet test him all. One time is 46 passenger. That's one flight. Another flight them lo Mosby where initial case been come down from Mosby to Ley, where we've been looking at some 7 of the 12 passengers where we've been identifying, including all crew. We've got testimony. Now we look at some results of some -2. All all the health workers all been go past the test too, all FOPLA, all come up negative. So that's us where we've been talking at this point in time. This law has been stopped close to law. This is the first case which all negative. So I'm giving good play indication of some one strategy government been putting in place through the SOE, the lockdown, begin to walk. It's working.
Yeah, words from Commissioner Manning yesterday. Commissioner Manning also stated that 160 test kits have been sent out to 16 provinces and there are 518 Port Moresby to begin testing. Mass testing of 200 a day is expected to take place to identify whether PNG has local COVID-19 transmissions. PNG IMR has tested 72 samples. Of that, one was tested positive of the imported case, and 71 had returned negative. Now, Dini, interesting to note is the current undertaking by government. People are not taking this lockdown seriously. But again, you may must walk bung one time na rere good pla time or time no good you may no save iba can behind. Tasol you must no can poret. Suppose you may behind him all health talk where government na all health workman Mary give him long you may buy me alright. All liglig talk all sem you may must wash him hand one time soap all talk where health minister now tas only point him out. Pass him nose time you kus one time elbow all sem. Na-stop long way long all place where planti man Mary bung long abrusim display COVID-19. Now lo display time government i walk him display lockdown. Ino lo poretim yumi all man Mary inside long Papua New Guinea. Long help him yumi too. Yumi use him display all time lo look out him yumi et na help long yumi na one pla time too long look long all something where yumi sa walk him before. Whether display by stop lo help him yumi or no good display kind time good pla long walk him display yumi mas ting long help lo yumi na long family na two all house line where yumi come long ema message I think he go long all public I all same he got plenty walk na ting or ask him stop where yumi got long gaman na health department too na online you go pass long walk him display walk against him slash COVID-19. That's all Yumi too must put him hand help him too. Long behind him all school talk where only give him long abrush him sick COVID-19.
Now all Manameri public must passing blow sack him talk must stop. If you got walk him now you move around in public places right, but lo walk blow legal call something or some go lo buy boy na display you know make him want a good plus something. No important na passing do sakem tokem you make him na every can bung him lo disparate so you may master him talk lo government.
True to us.
I think that's it for now. Before we go, MTV would like to thank the following partners, Protex and Telecom, whose support has made this program possible to inform, educate, make aware, prepare and update Papua New Guineans nationwide on COVID-19. Remember to continue on practicing good habits, that's hygienic practices, as wash your hands with soap and water, cover your cough or sneeze with a bended elbow, and remember to practice social distancing. I leave you now with Reverend Pastor Joseph Walters with words of encouragement and prayer.
Good afternoon. Thanks for joining us again this afternoon as we receive encouragement and strength and comfort and assurance from Scripture and pray to our God that God, who is always on His people's side, will once again rise on our behalf. And remember, our Prime Minister, the Honorable James Marape, and church leaders met on Wednesday, the 25th of March, to declare a 21-day prayer and fasting. And this is so important, like I told you this morning about a king in the Bible called Jehoshaphat. Because when a king or a ruler rises and takes the lead and says something, that becomes legal, or it is legally inviting a supernatural person, power, or force far greater than ourselves to intervene and intercept even in the situation that is negative, critical, and even destructive against a nation. So when the Honorable Prime Minister took the lead and said, let's pray, let's fast, then we are legally inviting the God of heaven, the God of Papua New Guinea, the God of Israel, and God of Abraham, Isaac, and Jacob, to come on our behalf and stand with us and fight with us and defend us from an enemy called coronavirus, that it will not come and cause havoc and destruction to this nation. So we thank God for our leaders. We thank God for God-fearing people in leadership who are taking the lead to making sure that God is legally invited to participate with us and help us fight and ward off this evil enemy called coronavirus in Papua New Guinea. In Jesus' name, amen.
Help stop the spread of germs and protect your loved ones with Protex. Here are some simple hand washing tips. Use soap or liquid hand wash. Vigorously scrub hands in circular motion. Scrub in between fingers and nails. Do not forget the back of the palm and around the wrist. Rinse with clean running water. Dry hands with a clean paper towel or cloth. Protex. Clean hands, good health.
A global pandemic has been declared by the World Health Organization.
COVID-19 can be characterized as a pandemic.
Our government, agencies of government, SOEs, business communities and the citizens of PNG are expected to mobilize and stand together to fight this common global enemy, COVID-19. We do this in two ways: follow the directions and adhere to messages from the government and authorities. Come forward and assist the authorities. We at Telecom chose both. We joined the government to appeal to every citizen to practice good hygiene and to take extra care. And in case of emergencies, please contact our hotline on 1-800-200. Telecom PNG, always there.
This COVID-19 awareness program is supported by Telecom PNG, always there. And Protex. Clean hands, good health.